Well, a wake-up call for maternal health care in this country. A new study released just a few hours ago from the Commonwealth Fund finds that maternal death rates in 2020 were 62% higher in states that later implemented abortion bans. And those states also had fewer doctors providing care to women compared to the states where abortion remained accessible. These numbers came before Roe versus Wade was overturned, so they could continue to actually get worse. For more on this, we want to bring in our ABC News senior policy reporter, Anne Flaherty, along with Dr. Jessica Shepard. She is an OB/GYN and chief medical officer at Verywell Health in Dallas, Texas, a state which prohibits abortion, by the way, and includes civil and criminal penalties for the procedure. So, Anne, you've been following this from the very beginning. You told us about the study. Now it's out, just a few hours fresh. Break it down for us.
So, Kara, they had a couple big findings. One was that among these states that decided to enact abortion bans, that they had significantly higher maternal death rates, 62% higher than states that did not. They also had a higher infant death mortality rate, and they also had fewer providers. That was a big finding, that among these states, there were significantly fewer birthing centers and fewer doctors specialized in caring for women.
So then, Dr. Shepard, you're an OB/GYN there in Texas. The study finds maternal death rates are 62% higher than states that kept access. So what do you see being done to make sure that mothers and babies are protected and healthy?
Now, that's the critical question, because we do know that from a reproductive health standpoint, even before Roe versus Wade was overturned, we knew that maternal deaths were really high when we compare the U.S. to other countries. So there already are significant inequities when we think of race, ethnicity, access to care. So if I were to think, even from this study, that we are going to see even higher rates of maternal death. And this is going to impact our women in disparaged communities, such as the Black and Hispanic community. So what really can we do to make sure that we're getting these women care is, one, making sure that we have access through hospital services, which, again, we have hospital deserts. We have communities that really don't have any health care at all. And so this is really where the critical part comes with how we vote and who we bring in to make sure that legislation is made priority when it comes to reproductive health, or else we're going to see these numbers increase significantly.
And Anne, you spoke with the lead researcher on this study. What stood out to you from the conversation?
So Dr. DeClercq told me that he said that of 12 states that have enacted, that have refused to expand Medicaid, 10 of them have these restrictive abortion bans. And he says that's a big problem, because you're talking about a really high hurdle that women have to jump to get coverage. And, we talked to him, I think we have some sound here, where he talks about that problem of women coming to doctors already pregnant with poor health. Take a listen.
If you have a whole policy that's geared toward not really taking care of women's health, except when they might be pregnant and you want to support the health of a baby, we shouldn't be surprised when we find out that there's problems with women's health.
So that's clearly a big problem, Kira, that when you have these women showing up seeking care, that they're already several months into their pregnancy. And that's what he says is a big problem with these disparities that we're seeing in parts of the country.
So then, Dr. Shepard, what are some leading causes of maternal death, and what can be done to ensure a healthy pregnancy, delivery, and, postpartum?
Now, just as we were discussing, getting care from the beginning of the pregnancy is absolutely crucial to make sure that we know that any issues that may go on maternally or fetally is taken care of at the beginning of the pregnancy. But also of note, we have to make sure that when it comes to complications, we know that the top 3 or 5 complications that occur with maternal death are actually preventable. So when we have something through lack of services, lack of care and access, and we see that most of these deaths are caused by preventable causes, that's what also makes it just kind of shocking, quite frankly, when we know that we can save mothers' lives by taking few steps to just change the institutions in which we can get these women care, making sure that we have the amount of doctors, midwives, and nurses that can be on these wards to take care of these mothers. And also, when we think of insurance coverage, we know that insurance coverage is not good enough that we can see taking care of women throughout the pregnancy, but also in the postpartum phase. A lot of these maternal deaths happen after the delivery of the baby. And that's really what we can do to ensure that we're taking care of mother during and after pregnancy.
And that's why we got to keep talking about it as well. All right, Anne Flaherty and Dr. Jessica Shepard, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.